One of the treatments that is coming to the forefront is the Emsella electromagnetic chair, as it's called, which uses high intensity focused electromagnetic energy to stimulate the pelvic floor muscles in much the same way that a woman contracts their muscles when she does a Kegel exercise, except in a supramaximal manner where you can tighten these muscles with the chair with much greater intensity than you can just with doing your Kegel exercises alone. So in one session on the Emsella chair, a woman's pelvic floor contracts about 11,000 times in that 28 to 30 minute session. Now, that has a huge impact on women. Some women can't even feel their pelvic floor muscles. The nerves have been damaged, or sometimes they've just been so stretched that they can't get a good sensation of even how to tighten those muscles. And yet, after sitting on the chair for 1 or 2 sessions, they start to be aware of these muscles again. And at the end of the 6 sessions, the stress incontinence that they've had before is markedly improved, if not completely improved. And not only that, going forward, they can then begin to do Pilates or pelvic floor exercises at home. And now they can feel the muscles. They can continue to get the benefit of that going forward. The Emsella chair can be used for women of all ages, but the most frequent patients I see that come to use the Emsella chair are women who have had a baby or 2 or 3 and suddenly find they've reached a tipping point where before they could control if they coughed or sneezed or exercised and didn't leak urine, and somewhere along the line the muscles have stretched or dilated to a point that now they can't enjoy the normal active life that they used to have. Now that's obviously a huge issue. If we think of how many times we cough or sneeze or run or are active with children, it's an enormous amount of the day. And so these women are looking for a way that they can regain their former self, and often without wanting to resort to surgery to treat the problem. The good thing about the Emsella chair is that it's a very simple device for the patient to use. Not so simple in its development or technology, but from the patient point of view, it's a circular chair that they can sit on in a comfortable fashion, legs apart, slightly leaning forward, and the woman finds the bit of the beam of the focused energy that she feels is working on the pelvic floor. And at that point, it's half an hour of sitting there, feeling these supramaximal contractions, but it's not painful. It's something that women certainly notice. They normally laugh the first time they sit on the chair. It's normally not a particularly unpleasurable sensation, but just a very odd sensation. So once women get used to it, they are completely happy to come and sit on the chair, read a book, and go through their sessions. Women come in to use the Emsella chair, and they come in for a course of 6 treatments. So the idea is that they come into the clinic and they wear something comfortable like gym clothes so they can find the right position. We tend to do 2 sessions a week for 3 weeks, or sometimes 3 sessions a week for 2 weeks. The sessions need to be approximately 48 hours apart at least to let the muscles recover. Some women find an immediate benefit even after the first session sitting on the chair, and it just continues to improve from that point. Other women with muscles that are less tight to begin with find that it takes about 3 sessions for them to really begin to notice the difference. But then after that, in the remaining 3 sessions, they find that the improvement is exponential. With the Emsella chair, not only does it bulk up the muscle fibers, but you get the development of more muscle fibers in the tissue. So that effect lasts enormously longer than you would get just by going to the gym and doing an exercise, or by doing pelvic floor exercises. So most women find that even 12 to 18 months after sitting on the Emsella chair, the issues that they had before are still very, very well controlled. Occasionally women find that they just want to come back for a top-up because they wonder, could the situation get any better? Or they've just noticed, at 18 months to 2 years, perhaps a slight fall off in treatment, and they come back for a top up of 1 or 2 sessions.